the first time you treat the cancer is always your best shot. And so we don't want people to go to the wrong places to get treated. We want them to come to the right place so that they can have adequate and the proper treatment, and they can have a good cure chance with their cancer.
All right, Dr. Labi, we'll still get to the issue of treatment, but let's talk about cancer itself. 2 days ago, like I said, World Cancer Day. Of what significance is that day? Let's start with that.
The World Cancer Day is celebrated every year, and every year we have a theme, something we want to run with or work with, which will help us to bring the focus on cancer, to address challenges and issues, and to make so much noise so that people can be aware, so that people, just like what we are doing now, so that people can be aware, so that the government can come out to help and tackle the surge we have with cancer in terms of identifying people who are at risk, identifying people who have the disease, and making sure that the necessary treatments are there. This year, our theme is United by Unique, and the theme is just to say that we do not want, because a black woman has breast cancer, to be less privileged than what the white woman will get. Every treatment that the white woman will get, the black woman should also get it.
So there shouldn't be any discrimination?
There should be no discrimination. We want there to be equality in terms of treatment.
That's right.
In terms of the chances of survival. We want everything to be fair. We want everything to be made available, and this stems from we making that noise and saying, so World Cancer Day is celebrated all over the world. And as we make the noise, so many initiatives are put in place. So many funding is being released. As of yesterday, a memorandum was signed by the parastatal for Nigeria, who is in charge of cancer. There's the Cancer Institute in Nigeria, signed with another medical college body to make sure that we have adequate training for specialists to treat cancer. So all these things are the product of the World Cancer Day, and so we keep making the noise to make sure that we get to where we should be. And the number of people who now die from cancer has significantly reduced because we now have so many things in place. So
let's talk about numbers now. Now that you've mentioned numbers, what's the current statistics on cancer prevalence and the incident as well as mortality in Nigeria?
So we will pick them. We will pick them individually. Okay. So because if we want to look at the incidents, we will be using global statistics. I will not be able to put our hands on statistics for Nigeria. So for men, prostate cancer, which is the commonest in men, we say is on the statistics of 127 per 100,000 men. We come down with prostate cancer. For breast and cervical cancer, that is higher. It's higher in the sense that we know that our population for incidence for breast cancer and cervical cancer is higher than that of men. And then the number of statistics is also higher in northern Nigeria for cervical cancer, and the other way around in southern Nigeria, breast cancer is higher. So we will be having different statistics when it comes to both breast and cervical cancer.
So I'm just curious, why higher for cervical cancer in the north?
So when we talk about cancer, we talk about
behavioral patterns.
Yeah, so it's more of behavioral patterns for why the northern. So in the north, we have more of polygamy setting. Where there's one man to many wives. And so that is one of the risk factors. So sexual history is a very, very strong point in cervical cancer because of the transmission of the virus, the HPV virus, human papilloma virus, that is predominant in causing cervical cancer. And so, but for the for the south, we do not have that high figure, or should I say high incidence in the south for cervical cancer as much as what we have in the north, because southern here we don't practice so much of polygamy as much as what we have there.
But for breast cancer, it is more prevalent in the south.
It's more prevalent in the south. But when you want to look at it nationally, breast cancer still tops the list for all our cancer cases in Nigeria. And
the question that a lot of people have been asking is, what causes all of this? I mean, what is it that would make cancer spring up in anybody, in a man or woman's body?
So we do not say, we do not know what is causing cancer, but one thing that we are sure of is that we have associated risk factors for all cancer groups. For prostate cancer now, because the man is a man, he's at risk of having prostate cancer. And so what
just for being a man?
Just for being a man, because every man has prostate, the woman does not have prostate. So the woman cannot have prostate cancer.
Right.
So, but on the contrary, for breast cancer, the man can have breast cancer because he has a breast.
Okay.
Okay, but it's commoner in women than in men.
So for men, it could be like 1 in a million.
1 in 100 is 1 in 100.
Okay.
So if you have 100 people with breast cancer, one of them is going to be a man. Okay, so that's the statistics for that. And so for breast cancer, we talk about risk factors. We say because they are women, so they're at risk. And then because they have a breast, so they're also at risk.
Right.
And then we look at age. So increasing age
could also be a factor.
Is also a risk factor. So increasing age for women, and then more in the age group of third, fourth decade.
All right.
Yes.
So let's also begin to probe this now. So or would one say maybe activities like breastfeeding, it could also be responsible?
Oh, sure. Yeah. So there are so many. So so we also look at the reproductive age or the reproductive life of that woman. Okay, women who started quite early, who started having children early, are protective. Okay, so because that means that their menstrual cycle is stopped early, and so it's protective. And the higher the number of children a woman has is also protective, and then the woman who also breastfeeds is also protective. And so we encourage women to have more children.
So when you say protective, meaning that
protective against breast cancer.
Okay, so they're likely not to get cancer.
Not that the woman who has 5 children cannot have.
All right.
Okay, but you will have more people who do not have children having breast cancer than women who have children having breast cancer.
Okay.
So nulliparity, that means the woman did not have breast cancer and is about the age of 50, makes her at a higher risk than a woman who has 4 children and is at the age of 50.
All right. Okay, so breastfeeding activity, that is very protective.
Yes.
What other thing could also be protective?
So for women too, obesity, their weight.
Oh.
Okay. It also has to do with increased body mass. So that is also an issue. Women who stop their period late in life. So because maybe they started their period early in life and stopped late. That also makes it, they have a long estrogen window. They are exposed to
so early would be from which age? 10, 11?
Well, yeah, early 10, 11.
And late
would be like 50.
Oh.
50, 55.
You mean you will see our women that are still experiencing that?
Sure, we do. So it puts them more at risk of also having breast cancer.
All right. Okay, I know you're going to be giving us some signs and the symptoms that could come with cancer, but the whole idea is for us to do some kind of advocacy this morning. Anytime people hear about cancer, there is that sudden fear, that's innate kind of fear that, look, is this going to lead to termination of my life? That kind of a thing. So what should be the approach when we talk cancer?
Some people call it the big C. In the fear of not wanting to say cancer.
Exactly.
So they call it the big C. And so it's just one of those things that, one of those diseases that is very scary. I remember some patients will tell you when they sleep at night and they are looking at the ceiling, they think it's about to happen. That means they're about to die. Okay, so I think we have moved a lot away from that. Technology has helped us to move a lot away from that. Science has helped us to move a lot because the treatments we didn't have available in years back, we have so many of them now.
Available now.
One of the things that used to scare women who have breast cancer in those days is mastectomy. That's removal of the breast.
Okay.
And so many of them, when they hear they're going to cut off their breast, then they will disappear and not come back to the hospital. And then the next time you will see them, the cancer is late. And so we don't even preach that anymore. We don't insist on every woman having mastectomy. We now have procedures whereby the breast can be saved.
You mean it?
Yes, we do. So, but that can only happen for a woman who comes in early and the lump or the swelling is still small.
Right.
So there are so many things that we look at to be able to save the woman's breast, but that is our aim now.
Right.
We try to save the breast as much as we can.
Dr. Labi, because of that fear that we just talked about right now, a lot of people have gone inwards. They've said traditional medicine could be a remedy, and that sometimes has gone the wrong way. So I need you to talk to that. traditional medicine, does it have a role to play in cancer care?
So I think this is the second time somebody is asking me this question this week, if traditional medicine has a role. Believe you me, if traditional medicine has a role, I think that's where I'll be now.
Okay.
Because I think we all want something that is going to give cure to our patients. We will not want, even you won't want your enemy to die of cancer, because it's really, really a debilitating disease that is very unpleasant. Pain, it comes with pain and what have you. So, but if caught early, treatment can be done. So I'm here to see people or anyone who has done traditional medicine and has been cured or is healed. So because if that happens, then we will try and go that route too. And the problem we have in this environment is that people will want to take that route, and then when they do, they come back to us when it is late and they say, oh, we've been trying it for a year and it's not working, and then they could decide to come back to have medical treatment, and then when they come for medical treatment, it's in the late stage, and if peradventure they die, everybody will say it's the medical treatment that killed them. Nobody will remember that the person didn't come on time, went for herbal treatment, and then came late to the medical team, and then that's why the person passed on. So these are just some of the things that we want to use this World Cancer Day to preach out there, to let people know that medical treatment is still the safest and the best option for people who have cancer.
All right. Lagos Traffic Radio 96.1 FM. This morning, we are still expanding the dialogue on World Cancer Day. And that was marked 2 days ago. But like I said, one day isn't sufficient for us to have this kind of conversation, especially as it relates to cancer and the myths and the misconceptions. We'll talk about that in a short while. But flash update coming in says there's construction work, which is very much in progress at the scene of a falling barrier on Carter Bridge inwards Ido. So there's a falling barrier there. So I guess reconstruction is taking place right now. But the good news, we have traffic managers on ground trying to manage the situation and ensure that you can move. The major connecting points to the island, the other two routes are still looking good. The Third Mainland Bridge is good. And then if you want to make use of Eco Bridge as well, is also looking good. Say for some rehabilitation work on Eco Bridge inwards Akpogmo. So take note of that as you drive along. All right, so let's talk about myths and misconceptions now of cancer. You said what cancer is, Dr. Alabi. What is cancer not?
Okay, so we have a lot of myths and misconceptions out there. I think one of the common ones is cancer. Sugar causes cancer. Okay.
Doesn't it?
So if sugar causes cancer, I'm sure that everybody in this room takes sugar.
You do?
And I'm sure none of us in this room has cancer. You know, so the honest truth is that there's nothing like that. It's just a misconception that people have lived with. And even patients who have cancer, somebody will tell them, don't eat sugar again, no, don't eat sugar again. You know, the cancer cells feed on sugar and what have you. So it's not absolutely true. No.
Okay.
So it really has nothing to do with that. So
anyone that has cancer, can he still do his regular fast food joints?
So those are the things we now need to talk about. We're talking about lifestyle modification.
Okay,
we're saying our lifestyle is important and is also a risk factor for causing cancer. Exercise, eating healthy, eating the right diet. Is sugar good? We all know, is sugar good? Of course, sugars are refined sugars and they are not good. So sugar is not healthy. Okay. We take them, but they are not healthy. Because we cannot do without them does not mean they are healthy.
Right.
Okay, so
we should just take them in very
small quantity. We should take them in quantity that is going to be beneficial to us, not quantity that we do not. A patient told me he likes Pepsi, and then the following day his daughter sent me a message that because said he could take Pepsi, he took 4 bottles.
Oh.
Okay. Now you see what I'm saying. So he decided to take 4 bottles.
Wow.
Honey is healthy because honey is especially honey that is real honey.
Right.
You know, we have a lot of refined honey that sugar has been mixed and everything.
Right.
If you can guarantee the honey is much better than sugar. And so some of these things we do not need the doctor to preach to us, to tell us. We just know what is right. In our inner mind, we know what is right. We know that eating healthy means taking adequate water, eating fruits, eating vegetables, you know, eating food that will benefit our body.
Right.
Okay, so those things that are excesses, the older you get, the more you should stay away from red meat because it's no longer good for your body.
Okay. So that's
but children need red meat. They need protein. They need a lot of egg to grow. And the older you get, the less egg you should eat because it has a lot of cholesterol. And then the cholesterol will damage your blood vessels and give you hypertension and what have you. So these are just some of the basic things we need to know as a people so that we can live healthy lives.
All right.
We should do regular exercises. We should not go to work all day, sit in the office all day, get back at home, eat and go to bed.
Okay,
we should have forms of exercises. So when we have this, when we get a good dietary and modification of our lifestyles, we have good lifestyle habits, then we will be fine and be fit and be healthy.
All right, so let's go to the technical ones now. So someone who is prone with or someone who has cancer, can he still perform in the other room?
Yes, he can perform in the other room. Okay, so I was a bit hesitant to answer that question because there may be a clause to it. Okay, so cancer is not contagious. Okay, so I think that's also one of the misconceptions,
right?
Cancer is not contagious. Most of the treatments are not contagious because some patients will ask you, they've heard that when patients are on radiotherapy, radiotherapy can get to the spouse as well. Radiotherapy does not. Even though we have some treatments that, yes, we isolate the patients where they are on treatment, but that is just in very few instances. And if that is going to take place, the person will be cancelled and told. Okay, so the person will be cancelled and told. But most treatments for cancer, they are not contagious, they do not spread. And the other room can be well taken care of. Patients who have prostate cancer and need to have radiotherapy, yes, or have some forms of hormonal treatment for prostate cancer, can have their other room events affected. But somehow, medicine has a way of helping them overcome that challenge by putting them on drugs that can enhance their other room performance.
Yes. Right. And even ladies that have cervical cancer, they also be.
For ladies that have cervical cancer, it doesn't stop them before. It doesn't disturb their sexual life. No, it doesn't.
Okay.
So we make sure we do things for them that will help them to still be able to function in the other room.
Right.
After. It may come with some challenges initially, but eventually they get fine and they're able to do well.
Lagos Traffic Radio 96.1 FM. All right, then. So this morning we're doing some kinds of advocacy as we reflect on World Cancer Day, and we're expanding the scope this morning. We'll talk about treatment as well. But if you also want to join the conversation, feel free to do so. 08099120777. That's the number you can send your WhatsApp to. And if you want to put a call across, feel free to do so on 09153877127. Okay, 09153877127. Dr. Adewumi Alabi is here. She's a consultant, clinical and radiation oncologist with NSIA Luth Cancer Center. All right, so what are the symptoms? What are the signs that will show that someone is coming down with cancer?
Okay, so let's start with the commonest cancer, that's breast cancer. So the woman will have a change in her breast. It may be as a swelling.
All right.
It may be red. The nipple may change, instead of being outward, go inside. The skin over the breast may look like the back of an orange.
Hello.
Okay, let's take this call. Hello there, good morning.
Yes, good morning.
All right, what's your name?
I'm B.
Hey, regular B, how are you doing?
Yeah, I'm very good.
All right. We're talking cancer this morning. B.
Yes, I know we're talking cancer. I have a question for the doctor.
Okay.
But I just want to ask too. There's this lady that comes from Ikeja Electric. Do they still...
Okay, that's the program?
Yeah, because I have a lot of complaints, you know. I actually wanted to rant.
Okay.
They are treating us in Ogba.
In Ogba. You guys have not been having light for quite a while.
It has been terrible. Even those of us in Band A too.
Okay.
It has been terrible.
All right.
So I don't know if they are listening. Please, they need to, fix up and do something.
All right. I'm sure they are listening.
Yeah.
They would get that. And of course, very soon the program will be back.
Cancer to the doctor.
Yes.
I just want to find out, does shisha and vaping, does it increase cancer? Like if someone doesn't smoke cigarette at all but takes shisha, Because I was having this conversation with someone. We were going back and forth. So I just want clarification.
Shisha and vaping.
Yes. Does it increase the risk of cancers? Of course, I know cigarettes does.
Right.
What about
e-smoking?
Yes.
Okay. All right. Thank you so much. That's a very good question. Doctor, could that be a causative factor for cancer?
Okay. So I do not know what is inside shisha. So I know smoking of cigarettes, tobacco smoking, there are risk factors for cancers, especially lung cancers and some other cancers. In fact, almost every cancer, alcohol and smoking is a risk factor. So I don't know what is inside shisha, but I am aware that for electronic cigarettes, those ones are safe.
Okay. Hello there. Good morning.
Yeah, hello, good morning.
All right. What's your name?
So my name is Namdi.
Okay.
I'm calling from Mushi.
All right, Namdi from Mushi. Go ahead.
So I have a question. I have a friend that his wife has cancer, but they are really worried about going to lose because of the price. So I don't know how affordable is it, and are there measures or ways to support people that actually have cancer, like for example breast cancer? So any kind of support that they get for this kind of issues?
Okay, so Namdi, your wife's friend, has she been diagnosed, and what kind of cancer is it?
It's a breast cancer, and yes, she has been diagnosed, but I can't remember the hospital that did, but I would confirm. But the point is, I actually told them to come to Lut, and they said, because I know they have a cancer center in Lut, but they told me that it was basically because of the financial side of it. And I tried to explain to them that I believe that there will always be some kind of support that comes with it. Standing Lut is a very big hospital.
Wow.
So I just wanted to confirm from the doctor if there is any kind of support they actually give to people, because you know the way the situation is in the country.
Right.
And people just get scared when things are too expensive.
Okay then. Namdi, thank you so much for that question. Doctor will respond to you, okay?
Okay.
Okay, thank you very much. Thank you very much.
Yeah. Okay, Dr. Labi, so I feel somehow hearing that, but is there any kind of support that we get from people like Namdi's?
Yes, let me finish the shisha question, then I'll answer his. So I just saw that shisha contains large amounts of nicotine, carbon monoxide, tar, and some other agents which are carcinogenic.
Right.
So anything carcinogenic, yes, is a risk factor for cancer. So I think I would not support anybody taking shisha. That. Yeah.
All right. So B, that answers your question.
Yeah. So the issue of support. Let's be honest with ourselves. Quality care is not cheap anywhere in the world. If you want to get quality care and you want to be sure that everything will be done the way it should be done, it's not cheap anywhere in the world. NSI Ilu Cancer Center is a public-private, and when I say public and private, that means it has a component of both the private and the public setting. So when patients come, we understand the fact that not every patient may be able to afford all the services, but we do have support programs for people who come, such that nobody is left stranded. Okay. Believe you me, I can say that categorically, that nobody is left stranded.
So you will advise the friend?
Oh, sure. I will advise the person to come. We have so many ways in which we get help for our patients. Some patients can access. We have an indigent patient support program for patients who cannot afford. We also have programs whereby we have NGO support, where we can link them with NGOs who come to support patients. We have people who walk in and say, "Oh, do you have any patient who needs help?"
Wow. So you'll be
amazed. Nigerians are kind-hearted people.
Right.
So we have people who come in and walk in and say, "Oh, maybe their mom or their father died of this," and then they just feel led in their hearts to come and support someone. So we do have that happen.
All right.
And just like I have said earlier on, the first time a patient is treated is the best time. Always go for where you can get the best. Having said that, even though I work at NSI Ilu Cancer Center, the federal government of Nigeria has also put some things in place in the government hospitals like FMC, Ebute Metta, Lasut. Okay, those are the two government hospitals outside Luth in Lagos, where we have this patient-assisted program funds, We have CAP. Okay, it's a cancer assisted program fund.
Okay.
We have so many of them, about 2 or 3 of them.
So she shouldn't be scared of going to the hospital.
Yes, where the patients get the drug at a subsidized rate. Government pays, I think, 60%, and the patient pays 40%. And we're still working on getting the government to even pay all.
Ooh,
okay,
which is
so
good. All right, so
yes.
Nnamdi, please advise your friend. Let the wife go out there and access treatment. All right. Hello there. Okay. All right. Messages are coming in here for you, Dr. Alabi. This one says, good morning. I am Bayo, 50 years old, from Mushi. Is cancer hereditary? My father had it around my age. Does that mean I will also have it too? Very pertinent question. So, Dr. Alabi, is it hereditary?
Cancer can be hereditary. You remember we said risk factors. Okay, so cancer can be hereditary, and that's why you should know what the cancer your father had, and if possible have a conversation with your doctor, because not all cancers are hereditary, but some are. And so we know those ones that are hereditary, and we know what to advise or counsel the family members.
It's prostate cancer.
Prostate cancer can be hereditary, can run in families.
You mean it?
Oh, you can see somebody say, oh, his father died of prostate cancer, his elder brother has prostate cancer, his younger brother has prostate cancer,
wow.
Or his uncle also had prostate cancer. And so for those people, the beauty of it, okay, so it's still cancer anyway, but the good thing about it is now you know on time, and you can start screening yourself earlier in life.
Right.
And so that when it is picked early, the chances of cure for that person becomes higher.
All right, this one here says, how can young people reduce their cancer risks? Ngozi is sending that one in. Ngozi, thank you so much for that.
You can reduce your cancer risk by living a healthy lifestyle.
Okay.
Living a healthy lifestyle means that you eat healthy, you cultivate good sexual practices, you stay away from things that can be a predisposing factor to cancer, and above all, screening.
All right.
Screening is very important.
Very important.
Very important.
And how often can one screen for cancer?
So different people with different, so men will screen for prostate cancer from the age of 40. Every man should have a PSA check. Okay. It's just a blood test, which is about maybe 15,000 now. A blood test once a year. And for women should have breast cancer screening. Breast cancer screening can be you as a woman checking yourself and checking your breast every month. Once a month, just once a month. Check your breast to see if there's anything abnormal.
Right.
If you've been doing it before, when something abnormal comes there, then you will know.
Right.
But if you've not been doing it before, when something abnormal comes there, you will not know. And the men can also be checking for their wives.
We can help out.
In fact, we have some instances whereby it is the husband that noticed that there was a lump in the wife breast wife.
You may will pay also.
So we'll pay, no problem. We are very happy when we have that, right. So that we can pick it early. So right. Other tests like mammogram, like scans are also available. Pap smear for women to screen for cervical cancer.
What about other kinds of cancers? I mean, I hear of leukemia sometimes, and I hear of so many other types. Okay, let's take this call. Hello there. Good morning.
Good morning.
Good morning.
Yeah, Mr. Victor, am I correct?
Yes. What's your name?
Okay, Dami. I'm Dami from Ogba.
All right, Dami from Ogba. Go ahead.
Okay, so I just want to go straight now. Firstly, I wish I could have this prostate cancer test, number one.
Okay.
Number two, I don't know, the major sign, can mommy just tell us one major sign of this prostate cancer?
Okay, good.
Like one major sign, because I don't know, from the private part area, one physical major sign.
Okay. All right. Just listen on your radio then. Thank you, Dami, for that one. All right. He's a man. He's very much concerned about himself.
Very brilliant question.
Yes.
So for prostate cancer, you know, the thing about prostate cancer is before the man will start having symptoms, is getting a bit, advanced. And so the secret is just to have a PSA check. Okay. That's the earliest way to check if anything is wrong. If you do a PSA check every year, if anything is wrong, you will begin to see from your PSA values that the values are going up. And then your doctor will now put his hand in your rectum to check if your prostate gland is enlarged. Okay, so but the symptoms that the prostate will give, urinary symptoms, the man may feel that, every time he's feeling like wee-weeing, he's feeling like going to use the toilet to pee, okay. Or when he wants to pee, there's difficulty in peeing. It doesn't flow freely,
right.
Or he feels that he wants to pee. Before he gets to the restroom, he has started weeing on himself. And so these are just these are
minor
just a
signs.
few.
All right.
So, and it's not everybody who has all the signs that I have just said, urinary problems, that has prostate cancer. Sometimes the prostate gland itself can be big, can be enlarged,
and not
which
cancerous.
is what majority of men have, and not cancerous. But you will not know. And so what you need to do is to go to the hospital so that the doctor can check you and tell you whether this is a normal prostate that is enlarged or this is a prostate that is cancerous.
All right.
So, but these are just a few of the signs. Other signs that may come with it may be backache, bone pain, body aches, and the likes.
Okay then, so as we gradually wind to an end this one says, good morning, doctor. Can a healthy person suddenly develop cancer without any symptoms?
Cancer does not know age, it does not know sex, it does not know old, it's
indiscriminate.
It does not know young, it does not know baby.
Okay.
So anybody can develop cancer.
All right. This one says, cancer treatment in Nigeria is too expensive. Are there any available financial assistance programs to help low-income families whose loved ones have cancer? Zainab, you sent that one in. I think you answered this one earlier.
So yes, but let me just still make a statement on that. I tell people, I said, having a will to get treated is always the first thing. Irrespective of whether you have the money or not. Just have the will to get treated, to live, and to survive cancer. Okay. Once you have that, the money will come. People have spent money that they never in their mind imagine that they could ever have access to.
All right, let's round this up now. This one says, please, is there a link between skin bleaching creams and cancer? Thanks. Moi is sending this morning from Dr. Moi. Thank you so much. So is there any connection?
Yes, there is. Skin bleaching creams have carcinogens, cancer elements of substances that can predispose the skin to cancer. Okay. So it's better to stay away from it.
So people should stay away from it. Dr. Alabi, 1 hour, even 45 minutes, never sufficient. Anytime you are around to discuss all of this. But as we run this off quickly, what's the message and where is your center located?
My center is located inside the Lagos University Teaching Hospital compound in Idiaraba, Mushi.
Okay. So the likes of what's the guy that said? Okay, Dami, so he can come there to have a PSA test?
Yes, he can come there to have a PSA test.
Okay, and Unamdi, please tell your friend's wife to go there and I'll try and access treatment. Like Dr. Alabi said, there are lots of things that you can get from it. Dr. Alabi, your final thought on the program this morning, quickly.
So just like we have said, World Cancer Day celebration is still ongoing. United by being unique, and so let us all come together as individuals. We don't want to wait till it comes to the turn of our family members to have it before we have the things to put in place to make sure that everybody is screened, everybody is picked early and treated.
All right, we have to go. Thank you so much for being here. Mike James has produced the program this morning. Maximum thanks to Remy Aluko and Okwemi Shodunke, both of them of our social media unit. I want to appreciate Onora Moloku, who is an advocate who's working tirelessly behind the scene for this kind of program to come on stream as well. Our executive producer is Tayo Akonle. My name is Victor Oteri. Have a great day. Bye.
Really nice. I take it